Hi guys, welcome back to the hospital series part 3. In today's video, we are going to be discussing about GPT Healthcare Ltd. Okay, so first let us understand the business model. If you look at GPT Healthcare, similar to the likes of Jupiter, like the likes of Yatharth, right? It is a regional hospital. You have Jupiter in Maharashtra and the adjacent areas. You have Yatharth in Delhi NCR and the UP areas. And if you talk about GPT Healthcare, it is in the West Bengal and the adjacent areas. Okay, if they have 4 hospitals in Salt Lake, Agartala, Howrah, and in Dum, which are around Calcutta, around the Calcutta and adjacent areas of Calcutta. Okay, so this is the 4 hospitals that they have, and if you combine all the 4 hospitals, as of now, as of Q2, they have 561 beds. 561 beds are there. Okay, and if you look at the payer mix, also majority 94% of the payer mix is coming from cash and insurance, and the rest 6% is coming from your corporates or others. Okay, others when I refer to it is government ka schemes. Okay, now let's look at this hospital. If you look right, if you look at the sales has been down by 2%. That too, again, down by 2% in a Q2 quarter. As you know, Q2 is the best quarter for hospital space, right? So in such a seasonally well quarter, your sales is down by 2%. And if you look the PAT is also down by a whooping, like not I wouldn't say whooping, but PAT is down by 7% also. So not a really great set of numbers. So why has this been the case? If you look at your hospital KPIs also, if you look at the occupancy has been down, right? Last time it was 59.9. Last H1 it was 59.9. This H1 it is 53. In fact, RPOB has increased a little bit. RPOB is up by 10%, right? That is the only saving grace factor over here, that the price could have been increased in the self-payer mix or the cash payer mix. Okay, so if you look at the 3 most important parameters, you see the sales, you see the PAT, and you see the occupancy, which is the volume growth in the hospital. All of them have been down, right? And especially in this PPT that I didn't like is these people, the Q2 on Q2 numbers was probably so bad, right? Especially the occupancy, RPOB, ALOS, all of these hospital KPIs were probably so bad that the management decided कि like हम Q2 का numbers नहीं डालेंगे, we will put H1 numbers, because H1 versus H1 is at least a little bit better compared to, let's say, Q2 over Q2. Okay, so why are these 3 parameters so bad compared to? Because I think in Q2, if you see, all the other hospitals have grown and the occupancy has been better. This is the one such space where nothing has been happening. 2 reasons. One is, of course, one is the due to Q2. In Q2 we have monsoon, like I told you. In West Bengal and in parts of West Bengal, there was heavy flood. That is one of the reasons why there has been a miss in terms of top line. The second reason is, as you know, in West Bengal, there has been that incident that happened regarding a doctor being, sexually assaulted in the hospital, right? So as a result, you would have seen, right, there was this strikes because doctors were not going to work. They were putting up strikes, doctors and nurses and all of these students, medical students. As a result, that would have also resulted in less number of days being operational in the entire months of Q2. So combined, all of these reasons are why you see that the top line and the bottom line has been affected. It's not just that. Even in terms of, if you talk about operation wise, this company, this hospital is the least interesting company out of all the hospitals that are there. Okay, because if you look at the occupancy now, it has not really improved post COVID. Like, it has been very quite stagnant only, and the only time you would have seen a bit of spurt in numbers in terms of occupancy and other parameters is during COVID, because as you know, COVID was one exceptional factors. Now talking about capex over here, these people have 2 capex coming up. They're putting up a hospital in Raipur and they're putting up a hospital in Jharkhand, right? 2 hospitals. Raipur one will be commissioned in Q4 of this year. It is a 140 bedded hospital, and the other one in Jharkhand, it is a 150 bedded hospital, but no clue as to like when it would be, when it would start, when it would be commissioned. The capex would be done and commissioned. Now with this two hospital also, they are following an asset light model where somebody else is building the owner is building the land, taking the land, they're building the hospital over there. These people are more like taking over the management. Okay, so this is also one thing to keep in mind over here. Okay, so overall, not a really great set of numbers, nothing quite interesting happening. If you look at all the hospitals, right, either there is growth or there is growth along with capex, right? This is one such hospital where the capex are doing further, but even in terms of capex, it is not that great. Like, you are having such a chota base, you should be able to do more capex capex than compared to anybody else. So capex ka rate is also not that great, and also growth is missing. Like talk about Jupiter, talk about Global Health, talk about Max, talk about Yatharth. All of these four hospitals that you see, for right now to make, for right now to give value to the investors, they have growth, but they're also doing capex because the existing hospitals are running at full capacity. So आगे जाके आगे का growth के लिए they're doing the capex. But here, even though they're doing the capex, like I told you, not sufficient enough of capex. At the same time, the existing beds that are there in the hospital, they're not reaching really good occupancy level. Growth नहीं है, making it a very unattractive proposition, right? So over here, if you look at all the hospitals, you see that GPT Healthcare has the lowest of the lowest valuation, right? It trades at a way less, way less. If you look at the PE, it is way less compared to the other hospitals. Again, understand this over here. It is trading at a lower PE because यहाँ पे growth नहीं है. That is why यहाँ पे it is looking very cheap, very सस्ता. Okay, that is the only reason. If there is growth, if it is at least matching up to certain levels of growth of at least Jupiter or the other hospital, it wouldn't be here. I would say out of all the IPOs that had come, in the last year, we had a lot of IPOs in the hospital space. This is probably the least interesting IPOs and least interesting kind of story that has been playing out over here. So that's that with GPT Healthcare. I will see you again in another video where we'll be discussing another hospital.